Atrioventricular block is a block of conduction of signals from atria to ventricles. There are four types of atrioventricular blocks. First degree atrioventricular block, second degree atrioventricular block, type 1, which is also called Mobus 1, second degree atrioventricular block type 2, which is called Mobus 2, and third degree atrioventricular block. First degree atrioventricular block is due to the delay in pulse transmission at a number of locations from atria to ventricles. It can occur at atrioventricular node bundle of His. ECG shows normal sinus rhythm, normal QRS complex, but prolonged PR interval. It is frequently found among otherwise healthy individuals. There are no symptoms. There is no need for treatment unless there is significant bradycardia. Second degree atrioventricular block type 1 is often referred to as Venike-Beck atrioventricular block. It is intermittent atrioventricular block due to impaired conduction within the atrioventricular node. ECG shows constant P interval but progressive prolongation of PR interval leading to non-conduction of P wave and dropped QRS complex. Causes are increased vagal tone, right coronary artery mediated ischemic heart disease. Treatment is, if patient is asymptomatic, continuous monitoring should be good enough. If patient is symptomatic, there is a need to give atropine and temporary pacemaker. Because it is often asymptomatic and has benign prognosis, there is no need for treatment. But in some individuals, it is symptomatic, especially older individuals and people who are having cardiac comorbidities. And if they do have bradycardia, then there is a need for treatment. In second degree atrioventricular block type 2, the atrioventricular block is usually distal to atrioventricular block, that is bundle of His. It does not send the steady signal from atria to ventricles and increasing the risk of high-grade or third degree atrioventricular block. ECG shows PR interval which is constant, but there is abrupt failure of conduction of P wave, meaning there is failure of conduction from atria to ventricle leading to missing QRS complex. Causes are bundle branch block, myocardial infarction, digoxin. Treatment is transcutaneous pacing. Long-term treatment is internal pacemaker. In third degree atrioventricular block, there is a complete failure of conduction of supraventricular impulses to the ventricles. Ventricular depolarization initiated by escape pacemaker distal to the block. ECG shows wide or narrow QRS complex. RR interval are constant, but variable PR interval. There is no relationship between P wave and QRS complex. Causes are congenital, myocardial infarction, heart disease, valvular heart disease, digoxin. Treatment is atropine, transcutaneous pacing. If it fails, then IV dopamine or epinephrine. Long-term treatment is internal pacemaker. Thanks for watching. Do not forget to like, subscribe, or comment.